Oncology-Lifetime Cumulative Dosing Documentation. Nursing, pharmacy, and providers can all access the lifetime cumulative dosing documentation that is going to be discussed here. If I was doing a chart check as a nurse and I noticed that my patient's protocol included a medication that required lifetime dosing documentation calculations, I could simply access the options from the toolbar, select the Add Lifetime Cumulative Drug Administration, and from the drop-down, select the drug that is in question. Since this protocol contains doxorubicin, I would select doxorubicin to see what was entered on my patient. From this profile, I can see that the patient has had one administration of 98 milligrams. Now, because this window shows milligrams and not the required milligrams per meter squared, another screen that can be useful is the oncology flow sheet, which I will show in a minute. The upper portion of this screen is for outside administrations. If the patient had received an outside administration from a site that was not on Cerner, this could be documented within these fields. I could simply put in the dose, which once again is either in milligrams or units if it's bleomycin. So for this patient, let's say they had a previous dose outside of the VPP. I would put in the milligrams the patient received. I would document their height at that time, their weight at that time, and the date that dose was received. I would enter the physician who the patient is under, and as for extra clarity here, I could document the milligrams per meter squared which the patient received, and simply click Add. This would add that administration to the outside administration doses. Now, if I wanted to see the milligrams per meter squared for those doses administered within the VPP, if I were to close outside of this window and access my oncology tab from the table of contents and look under the flow sheet, you could see in this screen that the patient had received 98 milligrams at a 60 milligram per meter squared dosing. Now, another question is, does the policy require the anthracycline cumulative dose calculation? For facilities who require this, the nurse could come under Interactive View and INO. They could access the Lifetime Cumulative Dosing Documentation band and put their calculation within this window for 60 milligrams per meter squared here, and I would say that I have verified this dose and sign the chart. From this point, once I have done my calculation, the question would be, does the ordered dose fall within lifetime maximum range? If the ordered dose falls within maximum range, we would continue on to medication verification and administration. If it was outside of the range, we would follow the workflow of treatment parameters not met. This concludes the workflow for Oncology Lifetime Cumulative Dosing Documentation.